Okay, I'm back. So thanks, everyone. Rebecca, if you want to move ahead, I think Ben is first up. I don't know if there's a slide there. Yes. So there's our agenda for today. And we're going to have Ben give us his updates first.
Yes. Can someone let me be able to present, please?
James is working on it.
Yes, he's
Very up to James.
Yeah.
Oh, everyone loves Teams. So, there is going to be a new update being released in the next couple of weeks. You should all hopefully receive the release notes next week. Three of the big new bits of functionality being released is phase 1 of grant management within Edge. There will also be an area in which you can record publications and the introduction of project level calendar appointments as well. So let's start with grants. So there you will have this grants tab available. So within each user, do this and go to myself. We have these user permissions here. So if you toggle on grant management, it's what will allow you to see this. In here is where you can actually then start recording grant information for your organization. This will work very differently to what most of you have been accustomed to using in Edge, because you won't actually need to have a project record to associate data to. So you can create and manage your grant outside of a project, and then you can actually allocate this to a project when or if you need to do so. So in here, we have a list of all our grants so far. Come in and create a new grant. You can put in your grant ID code. You can enter a submission deadline if you wish. You also then have statuses you can select, and very much the same as your project site status, you always have to select a date. And then in here is our main grant overview page. So if I come into our grant details, we can see stuff like application type, status. We can also select investigator role. You can also then assign the host organization. You can also link your funders and sponsors in, have the overall value of the entire grant. You can then specify what amount your organization is going to receive. And you also have a hyperlink here. So if you're storing documents in a shared drive, you can then put the link to the shared drive here as well. On top of that, you also then have your core dates that you can enter. You then have some options down the right-hand side. So here we have applicants. So this is taken off of your internal user list. You can then also come in and mark users either lead applicants or co-applicants. You can then, if you are the host of grant, you can then also list what other organizations have been assigned to this grant itself. And then when you want to link it to a project, you can come to your associated projects, search your project, and then either link this grant to a single or multiple projects as well. Next, if we go down to one of our projects, we then have the calendar option here. So this is what allows you to book project-wide calendar appointments. So this can include reminders for invoicing, or you can put in monitoring visits as well. The way that you book these works exactly the same as how the Edge calendar works as standard. And also down the bottom of the project, you will now have this publications area. So you can come in here and then start recording your organization's internal publications for projects that you're working on as well. So again, we have publication type, title, authors, abstracts. At the minute, this is all free text. We are going to look at including the ORCID ID, where you can type in the lead author's ORCID ID and then search for that paper and then pull that information through into this area. Any questions at all?
Then when will it be released? Oh, there's a question from Jessica.
Two weeks' time, I believe, Rebecca.
And Jessica has her hands up. Are you able to unmute yourself?
Hi.
Hello.
I think so. Can you hear me?
Yep.
Hi. Is this all on the project level, or is it on the individual site level as well? are all these functions on both?
So the publications and the calendars are both at project level currently. And then the grants is its own separate entity.
And the grants then, okay.
Yeah. So basically, because grant information can be quite sensitive, we didn't want that information to populate on the project level. So by
Yeah.
you linking these to a project, it just will appear within the main grant itself and will then pull through to reporting when the reporting is available.
I understand. Thank you.
Ben, while you are on the oh, James has your hands up.
Yes, I'm just reading the question from Doa in the chat.
Ah.
They're just asking who can see this information, just to clarify that.
As in the grant information.
I believe that you mentioned about the you need to enable the permission for the individual. So who has that
Yes.
rights and say, can you show that again to us?
So again, this is where it slightly differs to what you're used to. So you're very much having admin access and user access. However, within each user, we now have its user permissions. So as standard, the grant tab cannot be seen by anybody. However, an admin can come in, they can come in here and then enable this grants function to be turned on for either an admin or user. Whoever can then has our access permissions turned on can then see the grants tab and they can both come in here and add and edit information.
Ben, also I see other manager. Are they also available or is a future plan
Future
ethics?
stuff. So the API one is available.
Mhm.
So that's how you can manage who can see the API users tab within management if you're using the Edge API, because that's how you can control who can generate API keys. The other ones are not available yet. Yes, Natalie.
So once you have that grants, sorry, whatever it was called, checkbox in your user, then you can see all of the grants and all of the information for all the grants?
Correct, yes. So normally you'd only give it to your grants team.
Mm-hmm.
So a standard, like no one can see it. So you can go in and give it to individual users. So more than likely it just be the people that you want working on those grants to have access to that area.
And when it's connected to a project, then is there something that shows up in the project?
No, so we've
No.
kept that hidden for now because a lot of the feedback we've got is from users not wanting people to see that grant information. But I'd be interested to see what your opinion is.
But I remember there is a button that associate project. Is it still there or is going to remove according to what you mentioned?
So this is here. So this is how you can link it to projects. Eventually, when you start pulling your reports out, that's where will enable you to see what projects this grant has been linked to.
Jessica has hands up. Yep. Jessica, unmute
Just
yourself.
on the
Yep.
permission side, you said all admins can see it? Or can you
So
also turn it off
admins are
for
so
some
admins
admins?
are the users who can change the access permissions. As standard, no one can see the grants tab unless their user permissions are changed.
That's what I wanted to know. Okay, great. Thank you. Because, yeah, we might have all staff being added as admins going forward. I don't know. So, okay, that's
Yeah, so
okay.
again, it's up to you which ones of those admins you want to be able to see the grants tab.
Then while you are there, can you maybe also show people some recent release, the tag and URL, and there's another one that just show the spot where they can see it.
Yes.
The
So under
tags.
management, you have these tags. So these are workflow tags. Oh my God, there's some awfully named ones here. I'm so sorry. So you can assign these to workflows. How these are more routinely used is obviously you create your workflow. It's either a project or project site workflow. You can name it and you can assign departments to it. But if you want to keep track of, say, if it's Amendment 1, Amendment 2, Amendment 3, Amendment 4, you can create those workflow tags to then add to the workflow itself, which I'll show you in a minute. We also have these document types. So when you're uploading documents into Edge, obviously, when you receive documents from sponsors, the titles can be extremely long. So instead of you renaming the document name all the time, if you just want to create a document tab, let's say as either a protocol, patient information sheet, consent form, contract, you can then come in here, create this list. So when you upload documents into Edge, you can then assign it as a document type. So again, to save you continuously having to rename those documents. So if I come to project and go to workflows. So for example, here we do workflows and you can add these additional tags. So if I come into edit, you have the list here. So I could say this is a protocol amendment and then say that, and that will also pull through into your reporting. So you can then filter your workflows on the workflow tags as well. And then we also have this URL. So on top of being able to upload documents into Edge, you can also come in here and add a URL in. For example, if I grab that, it will give you a name. And then I can rename this if I want to. You can also then put a version in, and then again, this document type comes into play. So I name it amendment, comments, click publish, click save, and then that will give you a hyperlink within the project and project site level as well.
Okay, I see Jessica's hands up and also chat from Bar.
Yes, I'm just reading Barb's question in a minute.
No, that was old hand. Thanks.
So Bar has the comment, will they be able, still the grant question, if a standard user is assigned grant manager, will they be able to see grants to projects that they are not staff on? As in they will see all grants are part of the organization, or they must be staff on the project to see the grant for the project.
So Barb, so the grant exists outside of the project. The person with access to that tab can assign projects to that grant. They won't be able to see the project information unless they are assigned to it, but they just have the capability of basically linking the two together, if that makes sense. But me and you can always sit down separately if you want to, and we can go through it in more detail.
So
And I think
just clarify, similar
Yeah,
to
sorry.
other project, yeah.
Sorry, Rebecca. I was just going to say it's kind of like my question that if you have grants access, you can see all of the grants. So you would only give that to
Yes.
grant staff, like finance.
So just to come back to this, so this is only phase one. How this is going to move forward is we're also going to introduce grant level forms, workflows, and a document storage area, which again will appear down here. So if there's additional grant information that you want to record outside of these default fields, you will be able to do so. Another thing we want to do is also then allow you to take that overall pot of money and then distribute that among the collaborating organizations that you've listed, along with any associated projects. Then for the users that you've named as applicants, what we would like to do is within their user profile, there will be a grant section where if you have been named as an applicant on a grant, you will have a basic overview of that grant information, but you won't be able to edit or change anything, and you won't be able to see all of the organization's grants. You will only be able to see the ones that you've been named on. Hopefully that makes sense.
Yes, it does. Thank you.
I think it's a great start. So if there are any issues, we can still raise to you to make changes to some, to something.
Yes, because some of the
Especially for the
drop-down
access
lists.
rights, what can be seen, what not can be seen, those kind of confidential, how we control that. So
Yeah, so for example, if I come in and I now take that off and refresh. So as standard, this will be displayed. So as standard, no one can see it. That's only if you've got that enabled. Again, if you want us to do a separate session going through this more slowly in more detail, we can always arrange one. Any more questions, or have you all had enough of hearing me talk now? I would take the silence as yes.
Noah has raised up, has a hands up.
I don't know if this is the right time, but I want to ask a very off-topic question. But since Ben is here, I'll just take the advantage of having him.
Go for it.
As part of our workload tool that we're using Edge for, there was a question about the patient status and if there is a possibility to create a branching for the patient status under follow-up to separate between the interventional studies and the biological studies, because the workload for both studies are very different. So it will be very helpful to just flag the patient as a follow-up for one of the two studies and count towards the overall workload. Is that a possibility or something that can be done, or there is a way around that we can use?
Do you mind dropping that into an email to me, Doa, and I can have a little tinker around and get back to you?
Sure thing. Thank you so much.
That's right, no worries.
I mean, I think on that topic, the other option, so that's under patient status in follow-up. The other option we had thrown out ages ago was to have a completely different patient status for biology versus treatment studies. But I think that the thought was it would convolute the data too much because it'd be hard to compare then the two types if we didn't have the same the same factors for every patient that's put on. So that was just, I think, for what Doa is saying is like might be a solution then is to
Yeah,
at
I
least in
remember
the
that.
follow-up
Yes.
section. Yeah. So I don't know if there's
Yeah.
any more topics or any more suggestions people have around that area because a lot of those patient statuses do not apply when you have a study, and so we're constantly trying to figure out where we should best categorize our patients for those types of studies.
Can I maybe recommend this because we also have other discussion topics, so this will need more time. So Natalie, can we maybe move ahead the topic and then for the status workflow for patient status, we need a lot of discussion. Then we can see either this time or I'll leave it to but first email discussion, then in the next the upcoming data harmonization meeting.
Yep, I think that'd be
Yeah,
good
sure.
next time. Thanks. And I think there's some other questions in the chat, so maybe all that can be through email and can learn more and discuss it next time. Okay, so I think that from our previous meeting, we had some action items that are shown summarized here. So there was a validation sub-working group, and I think that they were able to meet between these the last harmonization meeting and now. So I think we'll have updates from that group later, if I'm remembering the agenda correctly. And action needed. So members to review project level statuses and suggest any changes. Are there, has that been, we could, I don't really know that if anyone has thoughts right now, but otherwise perhaps summarizing that into an email would be better than it's for next time. Okay, so we voted on some of the items that we brought forward last meeting. Here are the results. So the adopted network item was approved. The MRN format change was approved. The patient name was not, but there's only 5 no's. So I think we need a little more conversation maybe. That doesn't make it pass or not pass by being such a low number of votes. Unless it's not a full display of all the voting, I'm not sure because I know I voted yes. So, but perhaps if anybody who did vote no or has a concern about this item, can we just have more discussion on maybe there was some confusion what we mean by it? I'm not sure. As a recap, this was where we wanted to display the full name for patients or be able to display the full name. Reminder that right now, I think it's 3 characters in each of the name fields, but some people's names are shorter than 3 characters. And so we were proposing that this should be something that you control by policy and by, if you don't want to put the patient's name in, that can be you know, you don't, but we would like to put the patient name in.
So I want to clarify a little bit. When in early days, we all the sites that you on Edge that we have the PIA, the national PIA privacy impact assessment, saying that we are not going to put the patient full name. So I think that could lead to this why they say no, because the privacy say that they don't put the full name. So this voting is about you're still not going to put your full name, but allow other people to put their full name. So it's just not to stop others. Right now, we hide that field, the patient name, so that people cannot put on it only the initial and so on. So we put some limitation to forcing people not able to do it. So can we remove that one so that other people, if they want to choose to have full name, then they can still display the full name. So I think the voting is about that. It's not about changing that you have to have full name, but it's just that we are not stopping other people, other organization, if their privacy impact assessment allow them to display the full name. Would that change your mind that this would be a yes? You can put that into the chat for any concerns or email.
Yeah, I mean, I think otherwise, you know, oh, Jessica, go ahead.
Would it require every site then to go back and update their privacy agreement to inform them that this function is there? But for our center, we're still, adopting whatever practice you have agreed on.
Is that maybe a question for your privacy at your site? I'm not really sure, like if that's something that's explicitly that they don't understand rather that they do have an understanding of it, at how it is in the system right now, that maybe that does require a conversation with your own privacy team. I don't know. That's my thought.
I guess I just need a little bit more, I guess because I'm newer to this, like I didn't know if there was a standard. I thought when it was first set up ages ago, there was a standard statement that we submitted to our hospitals about what the functionality of and the privacy of Edge was. And so that this change would essentially be changing that standard statement that came from 3CTN about what the functionality was that we made our decisions on. So I just was wondering if there was any standard, like contract or standard statement that this would be updated, that we would need to then all take note of to make our individual changes. That's all.
I'll just
And
go to the
Aileen
next
had-
hand. Oh, sorry, Rebecca, go ahead.
Aileen's hands up before me.
Yeah.
Hi. I think that's a great idea for you to speak with your privacy officer, but for us at Lake Ridge, we just make sure that we're adding the correct data collection plan so that we're not collecting the names because our institution does not allow it. But I don't think that it matters if the system allows it as long as you're not collecting it. But I think that's a great suggestion to have a discussion with your privacy officer and just make sure you create a data collection plan for your organization that you're attaching at the project site level.
Thanks, Eileen. Doa?
Kind of same thing, like Eileen mentioned, at CHU, we waived the RAB approvals and other reviews because we agreed not to put any identifiers in Edge, and this is how we've been functioning since we started maybe 5 years ago. So actually, we don't mind, like, it doesn't matter for us because we will not use this function, but my only request is not to make it mandatory because it will be hard for us to go through all of this approvals to add the patient name, and this is not the direction that we want to move forward with. So my only request is not to make it mandatory.
Yeah, absolutely. It's not going to be a mandatory requirement. It's just to, enable
Allow
those
it.
who would want to be
Yeah.
able to do it. Yes, absolutely. Yeah.
So just so at the project level, if you choose Canada, so if you stick to the Canada, the one that we have, then it won't display. Then at your project site level, then you enable your own collection plan that include or not included information. So you can modify that one at the project site level. They don't have to be linked together. It's just that by the at the project level that we have that is just for the everyone, but you can still modify them.
Okay, so I'm not sure what the right way to proceed is. Is it to send out a form after this meeting with another vote? I mean, it'd be great to have an answer before the next harmonization meeting, but maybe that's possible. I'm not sure. And can people vote yes or no if they do get a form, so that we have a better number of votes in general? That would be great.
James can send a new form to everyone with the clarification.
Okay.
Or vote.
And yeah, please do vote. Okay, we can go to the next slide. Thanks. Okay, so a couple of new items. We wanted to talk about adding withdrawn as a project site status. So thoughts on that? It is available at project level, but not at project site currently. Project site. I see a thumbs up. Anybody have any concern about this? Or this is something we can add this to the voting form as well. I do see all thumbs up. I think there's no concerns unless you speak up, but we can put it on that I'm going to send a form anyway. We might as well stick it on there, I think, just in case. Okay, next one is about the delegation default roles and responsibilities. So we may need a little mini working group if we want to go ahead and change this in future, but this is sort of when you go to the delegation log and add in the default list that's available, we wanted to discuss the potential for changing what's on that default list. So I think the first question is how many people are using the delegation log, or, get an idea of that. And if so, like if you're using the delegation log, do you use the default list of roles and responsibilities? Maybe just if anyone does, or a show of hands, like of who, if you use those things. If nobody's using it, this is a different conversation.
From my understanding, I don't see any organization using that yet for the delegation law.
Okay, so if that's the case, like please do let us know if it's something that you are using. But if nobody else is using it and it's something that we wanted to adjust, then I don't know, would we still be a good idea to bring our proposal to the group? I think for eyes on it. I don't know, Ben, what's the right way to go forward if we have a proposal of how to change it?
Sorry, just for my brain to quickly catch up a little bit. So are you talking about the roles that
No,
the user is assigned to when you add them to the delegation log?
So there's a list of default responsibilities and roles that you can easily add at the project level that then people can
so
pick.
you mean the delegation log that you can just go and add
Barb
in
has
straight away.
put an image, I think, in the chat. Thank you, Barb.
Oh, it's not opening
That
for me.
helps. It's a default set of responsibilities that you can add in the delegation log at the project level that then you can check off for each person that you delegate when you're in the delegation log. Yeah.
Yeah, so from memory, we've only put that in as a kind of a quick starter, because obviously most of the time people will actually be putting in or copying from the actual delegation log from a project they're using. So that list of responsibilities is more just about if someone wants to get started. I don't think I know many people who actually use that.
because it's a really fast way to add a list of
Yeah.
standard, if there is, which we do kind of have a standard list. I don't know, Barb, if
Okay.
you want to provide some more language around where you got, the list that we use now. Barb might have
I'm
better
quite lucky
context.
because we don't have a standardized list in the UK. They're all different.
Any
Yes,
comments,
I-
Barb? Yeah, go ahead.
Yes, yeah, I can definitely speak to that. So,
Oh, I was
yes,
so
there is
jealous.
variability. Yeah, exactly, Heather. There is variability in, specific tasks and how broad those tasks are. Like we have seen variance, and some sponsors have very broad buckets of tasks where others are more granular. Within UHN, we have a standard task roster, like task list, and as well with external sponsors, they use a standard task roster as well. So I was wondering kind of if we could assess like the mapping of the default roles to a couple of these standard task rosters and maybe submit a proposal for that. Mhm.
There's some question on the chat, and just so even though there's sites not using it, but I do remember discuss this with the pediatric group. So the pediatric group delegation law seems very complicated. So when we maybe not only if you have a standard, maybe see email, I can email to all of them
Sure.
to see whether they capture everything.
So,
whether it's
yeah.
comprehensive enough to also fit to the pediatric groups.
Yeah, and I think the idea with this default list is that you can still absolutely add and delete from that list. It's just sort of a quick way to add things that are most common, I
Yes.
think would be the way to use it. We
Yes.
would, if people have a lot of, variability or specific things that are unique, then maybe those should not be on the standard list, but we should try to keep it to things that people generally agree are commonly used. That would be my suggestion, but why don't we send something around so we don't, we have our proposal, and then we can just see people, can give input on if they think some things are not specific.
Just
We have
reading something from the
yeah,
chat.
standard delegation log. Also, there is an N2DL template in the SOPs. It's from Kathy. So maybe Kathy, like if we compare our standard, maybe there'll be a lot of overlap, for example, right? Or we could agree upon something that meets the middle. I don't know. Let's get that started as a conversation, and anybody will share around our proposal. And then if there's a group of people who are interested or have thoughts on it, we could have a small meeting about it. Does that sound like a good plan? Great. Okay. That's the next steps for that one. The next item is we wanted to just get people's gauge opinions on whether this is something that we should pursue, like, cause I know it will be something that Ben we'd have to take to development, and it would have to go to other parts as well. But we just thought, well, this is what we think it should work. But if nobody else likes it, then that's dead in the water. But if it's something that people agree would be a good idea, we can try to move it forward. Yes, the project and project site level dependency, with only referring to the fact that we think that the project site should not be able to be open unless the project is open. No further dependency than that. We don't want to not allow, anything else beyond that. Just that the project site shouldn't be able to open unless the project is open.
Yeah, I have some concern about this. So right now, almost C17 and also 3CN coordinating center are managing the project level status. Sometimes we do not know that it is open. So when we see a site open, then it kind of, when they reported to James, then it prompted us that, hey, this trial is actually open. No one tell us that it's open. So if we do not update it or we do not have the information, then at the project level, then we don't know how we can do that if they are depending on each other.
So you're controlling the project level, but you don't know when the project opens.
Yeah,
Does
so
that-
the
yeah, I mean,
sponsor,
that's-
because we don't have the sponsor information that is open directly, but we would like to have maintained kind of like Canadian portfolio kind of general sponsor level status when it is open. As long as there's one site open, then we know that, then we will mark it as open. but we may not know that information unless we tracking all the time from the clinicaltrial.gov, or a site tell us, or the sponsor inform us. Then how can we do that if the site do not tell us that it's open, then we won't be able
Yeah,
to turn
I
it
see
on.
your problem, but I mean, I think, yeah, well, let's go to the other hands. Jessica, go ahead.
I think my comment is different. I've had in the past needing to reopen a project to add old follow-up patients, because not all of our old projects had been set up when we first started. So in order to attempting to get to a point where we have all old projects with the number of follow-up patients listed as well, so we have an accurate workload analysis. But the only way to do that is to reopen the project, add my participants onto the participant list, of course, as follow-up status, and then reclose the project. So I don't know if there's another way around that. And if we make them linked, then I wouldn't be able to do that.
We're not proposing so much linking it. You would be able to do what you just said. It's more that the project site couldn't open unless the project was open. So
But
unless
at the time, the
misunderstanding.
project level is already closed. Nothing.
But the
So if
project-
the project site is closed, then Jessica would not be able to reopen it to enter those follow-up patients. There's some sites that still want to add the legacy patients. So
Oh, yeah, the project would have to be open.
James,
But
Yeah,
the project
exactly.
could be reopened for that work to be done as well, but yeah. Mhm. James?
Yes. Yeah, so I guess, would you think about the other way around? So like because you're just wondering, so is it to prevent trial sites from opening if a trial is closed? Is that the goal?
It's really, yeah, it's really because at admin level, we're controlling the project, sort of at a like the owner of the project or at our admin level would have that ability to open the project there. But the studies team can open at the project site level. And if they do that incorrectly, then, as Heather points out, the reporting, like we're not really confident in the data of the status at the project site level.
But yeah, so at some point it is at a site level to make sure the data being entered is accurate. So you would have to run, you can run reports and compare data. But that being said, for the issue, like Jessica was mentioning, with having to add patients for closed trials, there is the option to import patients. You can import to a closed trial from the management tab. So you could get around the opening a trial, adding a patient, closing a trial option, because importing kind of negates the status. You can just import patients to closed sites. That's an option. Yeah.
That's super helpful. Thanks, James.
Yeah.
Yeah, because my admin I don't think she gave me that option, so that's good to know. There's a workaround. The other question though is what would happen if the project closed, but then all the sites were still open? Would it automatically close?
No, we're not proposing to have that connection because there could be cleanup, things might, and especially, no, we're not proposing that connection. Just the open one, just the things, if the sponsor hasn't said that the study site is ready to go, or they haven't given that final approval kind of thing, or, the institution hasn't given its approval, depending on which type of study we're talking about here, that the project site shouldn't mistakenly set their status to open until they've given, the proper go ahead.
In the past, it seems like it's never an issue because we are usually a little lag behind that for the project level. And also the project site level is supposed to be more accurate than the everyone maintaining their project site level status. So
Yeah, it makes sense. But I just one thing to add is that I guess we're using it perhaps in a way that other people are here are not using it, in that we have a lot of investigator initiated trials that we're going to be putting in, things like that, where it's really about our institutional authorization to start the project, and that are somewhat different from I think what the majority of the use might be. I mean, I could be mistaken,
Yeah.
but
I think as long as you are the project level owner, so your status correct, then you can immediately see other people that incorrect, then that can be very easily to QC those. So James and I, we QC the status every month, that if a trial is closed and how come and if the sponsor already closed the trial, how come some site still open it? So we use
Yeah.
some kind of how the trigger that the people had the wrong status and so on. So
yeah,
maybe
we can use a
using
report
those
to
and-
compare. Yeah, it's a proposal. So yeah, totally. James?
Oh yeah, I was just this could be more for Ben, I don't know. But it's more just
Don't
like
say that, James.
instead of instead of like the mandatory you can't put open, it could just be like another pop-up box or dialog box that just says like you have to confirm that you're opening the trial. It's like the status is it like when you go to delete a patient, it asks if you sure you want to delete a patient or give a reason to delete. If you did that with trying to open a site on a closed trial, and you have the option to still open it, but you would have to you just put in the descriptions like why you're opening this trial, and then that would prompt people to think whether or not it is accurate for them to open a trial. But
It would be useful to have at least like a sort of some kind of warning when you're opening a project site when the project isn't open. I mean, because really like from, I think, Ben, from your guys' point of view, like the project level is sort of, again, it's where you're getting your active study counts and things like that. So it might be
Yeah.
something to consider.
Yeah,
Yeah.
Heather has
Yeah.
hands up. Yeah, for us is that because we don't, there's so many site status. So for us, when we have the trial listing for Canada, so we have a Canadian portfolio status, we need to have some sort of status. So we go by the sponsor level or mainly clinicaltrial.gov, but with some verification that because we also get some kind of direct email from the sponsor saying that the trial is closed. So just from our end.
Yeah.
So for
And I
Heather,
just-
sorry, Heather,
Yeah,
go
just
ahead.
and just going to point out the Barb's comment in the chat is really what we're talking about. Really only that open, not the other statuses. But yeah, go ahead, Heather.
Yeah, I think I'm saying the same thing. Like how often, like yes, you can run QC reports, but it's still a lot of work if you have a high volume portfolio to keep following up with people to do stuff. And in cases where like how often would we ever have a project that is pending and a site that is open? Like, wouldn't it make sense that if even one site has flipped its status to open, that the project would just automatically open and then nobody needs to QC?
But we're not proposing doing it that way. Sorry, Heather. We wanted it to be control, unless I'm mistaken, which it's possible, right? Because I thought we wanted the project to be controlled at the project level, that the site couldn't be open until the project was open.
Can
For
be
sure,
both.
Natalie. Like I think that works
Okay.
for us just because of the way that we're setting up. But I think what we're hearing from Rebecca is that they don't always know when the project is open, therefore it would affect the sites. Like their workflow is backwards. But if
Yep.
you flipped the logic so that way, at any
We don't-
time point, if a site opens, by
Yeah.
default, the project has to be open. Like you
I
can't
don't think
have a
we
site
want
open
that.
and a project not open.
Right, but I don't think we
true.
want that to be an automatic function where if the project team sets their site status to open, that it would turn the project level to open. I don't think we want that.
Why?
Because then we wouldn't be able to QC what things had, institutional approval, like the way that we're proposing it. We have more control over what's the project is open. We can discuss
Because our
this
IA is
later.
going into the project level, not to the
Yeah.
site level. Is that why?
Yeah, yeah.
Mhm.
Mhm. We could
We don't have
discuss,
a
like there
check
might
on
be a
ours,
different
though?
way, so we can
Yeah.
discuss, because we can discuss, like we could change things for sure. So let's take that off and have more conversation.
Yeah, for us, I get the A then B. I'm just thinking about more Rebecca's flow. Like, I mean, theoretically, sites
Yep.
should know if they're open, be able to flip it to open, but when you can only have one project owner, it just gets to be really complicated when it's not
Yeah.
like we're not the sponsor.
Yeah.
Because then you're always dependent upon a sponsor. Like that's where this gets to be clunky. But yeah, I know why we're asking for it. I was just trying to see if there was a
Yeah, let's maybe
solution for
write it
others.
down then to see what how can we streamline the process better.
And Ben, maybe just one follow-up question to you then, if you know, like, is this a change that can be specific to Canada if we came up with something that we wanted, or is this something that has a bigger impact?
You're really making me think now. I think it would have to be if we went down the road of it popping up a little warning box if you tried changing a site to open. If the project wasn't, I think that would work best.
Mhm.
I just need to work out because obviously we're quite fortunate in the UK where we've got something called CPMS, which is where that project level information is fed from. I don't think it would cause issues.
Yeah,
I think
because
having
I
a nice
think,
little prompt
yeah.
to make sure that you are doing something that you should be doing would probably be best.
Yeah, because Ben, like for the UK, like your workflow is that everything comes through at the
Yeah,
top level. You guys set up all the projects and then you push to the sites, right? Like that's just the UK workflow because of the way research is set up within the NHS, which I guess is part of where we're hitting the roadblock here, is that we don't set up
don't
the
have
same
the
way. We're
same.
not set up at a national or
Yeah,
even at a provincial level. We're set up at a site level.
yeah,
And then we're trying to like work backwards, right? So it gets really complicated just because we don't
yes,
have a national or provincial intake. We are site level intake. And then the province or, national
yeah.
side may find out or may not. So it's just not the same flows.
No.
So
Would the little warning help you more, Heather? So if someone did try opening a site when the project wasn't open, it actually warned them going, FYI, the project isn't actually open.
Yeah.
It would that
Warning seems
think
like a good
trigger
idea.
people to go talk
Yeah.
to people more?
Well, you know what, Ben? Like, I think the whole thing is like, even like for our center, I think we're going to try to like centralize it, though it's extra work. Like everything we do is now in duplicate to make sure everything works properly, which really is sounds little, but when you multiply it by 1,000, it adds up quickly, right? Like
Oh
when
yeah,
you're
no, I
doing
know.
with high volume sites. So like each of those extra steps actually, takes away from a lean model. So I think the warning in general may not be a bad approach. I think probably the biggest issue for cases where it's backwards is that sites, if they get the warning, what is the incentive for them to go out of their way to reach out to somebody to make sure they flip it to open, to make sure they do their stuff? Like, I think those are the pieces that we sometimes need to think through is it's not just the workflow, but the why. Okay.
Yeah,
Because if somebody doesn't even know who to reach out to, because the person who flipped it isn't normally the person that works maybe with Rebecca, then that becomes an issue too. Or it's more ease. The easier anything is, the more likely it's going to get done. When things are too complicated and people don't see the value to their own work, they won't do it. I think we can hope for goodwill, but the reality is when people are busy, goodwill falls off.
true.
I don't mean to
Yeah.
be negative, and I'm not trying to be
No,
like,
no, no, I know,
Yeah.
Heather.
but it's just
I've
kind of
worked
like,
in the
here's the
hospital
names
for
of human
10 years, I
nature.
get it.
Yeah.
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 Okay, so maybe we can have further offline conversation on this, or unless there's other comments I see in the chat. You would, yeah, an idea for how we can make it work. Uh-huh.
Yeah,
Um,
I want to address Kathy's point. So we do look at the Canadian status, not the international. So if we get that information that for the if the even though it's international open, but the NOL and other information we get if the Canadian side has not opened, we had the centralized activation dates from CCTG, and also if C17, so we go by those ones, so we'll modify those ones so that it's not blindly that international or control open, then it's open, but still not all kind of accurate. So we do.
I
Yeah,
think what,
we've just had a lot of situations, I think, in the last little while with especially with the American ones, of them randomly making decisions to, oh, no, there's a problem, we won't open. So we do have sites not necessarily knowing that, oh, the workflow is different now and we have had to not open it. But sometimes it's just an error. So a pop-up might be, if there's a way to, I don't think it should be an automatic flip, but I totally agree it needs to be easy because the more complicated it is, the harder people won't use it. Totally agree on that comment.
yeah,
I
but
really like the
Kathy,
idea of the pop-up warning, so then it can prompt us to review the trial and then make sure it's up to date, the status, everyone.
yeah, okay.
And then the next one is from JCC, but Ben, can you maybe forward the definition there?
Give me 2 seconds.
Sorry?
I will quickly go
Uh,
find them again. I sent them to you, didn't I? Yeah.
So the in one of the meeting that JCC raised that for the site overview pages, project site overview pages, there's a site recruitment period calculation and also accrual to target, accrual rate, but it's go by the UK definition. But Canada using differently. So I just want Ben to forward that definition to let everyone aware what is the definition right now in the project site level. And if anyone from JCC today, that whether you want to raise your concern now, or whether you want to look at the definition for everyone look at the definition and come back with your concerns and questions later on by email.
I believe Ben has added this information to the chat.
Yep. So is it Amanda from JCC here? I saw Amanda here.
Hi, Rebecca. Yeah, I'm here.
Brenda mentioned this comment to our team. So do you have further information do you want to raise now, or maybe send an email to us?
I think if I'm thinking the right thing that was raised, it was the how it's under the milestones. Is that right? The open to recruitment and how it's in brackets. It says date, site, ready to start. So we currently are using that as the date the sponsor activates. So we're not site ready. The date site ready to start was added after the fact. It wasn't always there. So we had started using that field for when it's open to recruitment based on the sponsor. And then sometimes there's a delay from when the sponsor activates us until we're site ready. So we were capturing the sponsor activation date there. And then when the study did open to recruitment and we were site ready, that would go under the project status. That's where that date would capture, but there was sometimes a difference. And mind you, our goal is to have there not be a huge difference in that date, but where we're at right now, there is a difference, and that's how we were capturing them separately. But then the field changed to say that it's the date site ready to start, which would conflict with how we're using the field.
So that's an update from the UK. We are going to be adding a date site confirmed, which might be useful for you saying that as being when you've been confirmed by the sponsor.
Yeah.
Which would then allow you to then use the date site ready to start be basically your open to recruitment date, if that makes sense.
Yeah. Yeah, that would actually be
easier?
super helpful. Yeah, that would be great.
Okay, so then let's wait for the update then. So
okay. Rebecca, is this for you to give then, or
yeah, I can talk about some updates. Bar, do you want to maybe have your comments first before my updates?
Yes. I just have a question for what Ben put in the chat. Is this is going to be an update? So if project site approval is set to HRA approval, then these metrics will display? Because currently in the okay,
because
in
you've
the
got your
metrics
own
clock,
approval, so obviously a lot of these probably won't work for you because you use REB approval in Canada. Is that correct?
yes, that's the one we're setting to our project site is REB approval. But so in the drop down, there's REB approval and site activation. So but the metrics and clock is a default right now. So even if I don't set an approval to the project site level, the metrics and clocks still look like that.
Yes, so a lot of these calculations won't work for you by the looks of it, because obviously the recruitment clock, SSI to first patient, SIV to first patient are relying on UK HRA fields to do a lot of those calculations. Do you have a standardized way of working in Canada for what you deem to be like site ready to start to opening to first consented to first recruited, etc.?
We don't have a national one, right? Do we? But we
like
have
I think
some
this
that,
is something that's in progress right now. Like will we end up with one? I don't know, Ben. There's a
We
lot
can
of
live in hope.
conversation. I think we may have faster uptick. I'm going to say more at a provincial level, like Quebec. I don't know if we have anyone from Quebec on the call. I think we do have people who are part of the group. Like they've moved towards their Catalyst program. I'm sure there are definitions there that they are standardly using.
Okay.
CTO, like Ontario is working with Clinical Trials Ontario. And there's ongoing conversations about standardizing some of the language and definitions around what it is to start at that table. So that has, most of the TAS and hospitals and the larger centers. Like some of that may carry over or get harmonized at what's referred to as a CAN reg, which is the Canadian like REB harmonization review
Yep.
process. But I think that's probably further down the line and probably more complicated just because a lot of provinces, they have stuff set up, right? So it's a lot harder to say, like everybody moved to the same thing when things are so ingrained at like a large level within a single province. I guess, it gets trickier. Does that help but not help all at the same time?
A little bit.
Okay.
I
I
think,
know for
yeah.
Ontario, it's a very big conversation happening for like the CTO level.
Yeah.
Again, a little bit more focused on industry versus academic, which is a bit of a different portfolio than 3CTN.
Okay.
But I know for those centers, there's regular conversation about the fact that even if they don't officially call it institutional authorization, this principle has
Yeah.
definitely been picked up provincially. And that principle is that we have all of the required approvals within our institution to effectively open. It does not mean the sponsors opened us. They may not have sent us all our kits or drug or whatever. That's on them.
Yeah.
And they won't activate us until they have that stuff ready. But at least within our own institution, we've done what we're supposed to do.
Okay.
That
I
kind of
might
help.
get you just to educate me for an hour one afternoon about
Okay.
research in Canada and how different it is to what I'm accustomed to.
Yeah. Anyway, again, it's a moving target here too, so probably just something to be aware. But I know I was at
Oh,
a
yeah, no,
meeting
100%.
last week, and institutional authorization was a hot topic amongst the different
Okay.
Ontario sites.
definitely. So I think we need more conversation also here that we are reviewing all the KPI metrics for the CTN to see what for our new strat plan beyond 2027 what need to be changed. So we could have talked about. So I want to just give everyone some updates for the working groups. We do have quite a few working groups. We have the system validation group, and the finance costing group, and the workload management working group was previously that we have that one, but we kind of finished that one. So the workload, just for clarification, so it's using the OPAL score and then adapted other status from Edge, then do offline in the Excel. Then we have a template for everyone that when they download the report, then they can calculate the workload and so on. So that's just for clarification for the workload. And I'm also thinking of the AI working group. So before I talk about AI working group, just want to give the updates for the validation group and finance costing group. So all the information, the meeting material, meeting notes that also share within Edge in the live project. One is called 3CM member resources, and the other one is Edge Canada Data Harmonization Group. So under the 3CM member resources, for the validation working group. So we have the file share by Alberta, London, and also Princess Margaret that Bart sent me some information, and also Sunnybrook share the validation. So in our first meeting, so we consolidate and review all the existing material and also review what we have left last year and the year before, and then create a document, 3 documents called for the national validation. So I'm consolidating all those documents to work on the one that so that we can get the validation done, and using very kind of aggressive timeline that aiming by end of June, the end of June this year. So with this timeline, so right now we only have a small group people. So I'm calling everyone interested in the validation at your site level. So please join us and then put your screenshot and so that you can customize some of the screenshot. Because the plan is that we can have the Edge Canada master plan and also have the chat list, and also have some of the screenshot at our level. But at your site level, you may have also your own workflow that need to put your screenshot. So if you want to join that one, then in the list drop down, then in the list of the organization joining this validation, then we can also list your name and also add the additional site level screenshot to the validation. So please contact me to join that one, to join the meeting. And the validation template and documents are already in that folder. But if you want more information, you can also review the meeting notes that I share in the meeting invite. So that's for that validation. And then for the finance and costing group, for a working group. So this one actually is very exciting. There are a lot of sites interesting in that one, but we're not able to have everyone to join the first meeting. So we share the meeting notes with the group. If you still want to join that, feel free to join us. So the topic, we are very happy to announce that we have Amy Henderson. I don't know whether, are you on the line? So we have Amy from Ottawa and also Leo from London being the co-chairs for this group, and also have Stephanie willing to also, and also James and I, three of us maintain the documents and also review the meeting notes and so on. So as a kind of committee. So the topics that we narrow down is that we're going to, this group is regardless of whether you're using Edge or not. So we're going to discuss the negotiation tips and also using a case study to discuss the budgeting, and also how to and how to develop the template for importing into Edge. So the last one, the technical side for importing, is actually not that hard. But the other part that we got a lot of people's interest about the negotiation and also the case study and so on. So we have the meeting notes and also first case provided by Ottawa. So we're going to use that one. That the next meeting will be May. So if anyone want to catch up for that one and also want to join that, please let me know that we can include you in the upcoming May meeting. Okay, so that's for that. And then the next one is about the AI working group. So this is new. So right now, I'm exploring using the Microsoft Copilot to auto review and QC the OPO score. So for those one do not know the OPO score, so this is one of the complexity scoring developed by on the previous OCNIN. So right now, quite a few sites, organizations are using it, even outside Canada. There are some organizations that like to use the OPO score. So I'm exploring using the Microsoft Copilot agent to review the information. But that's within my own organization. I'm only using the public information to calculate the OPO score and then put that into Edge. So if you're interested in reviewing this and also show you how to set up the automation in the agent, and then also update those, review the scoring in Edge under the session OPO scoring, please contact me that I can include you into that one. And also other ideas that are related to the AI working group that I can also interested in having more people to join me. So that's one of the other working group want to mention here. And the next one is about the Edge training. So we realized that a lot of new functionalities and also a lot of areas that people may not be familiar with. And then each time there's some small updates. So we're thinking of like have some more group training and also some drop-in session. So James and Sylvia discussed that we can target the site staff and PIs and data manager, finance staff, new or old staff, and so on for the training. So the possible topic can be the basic topics or the advanced finance costing reporting and the OPO score and other usage that new ideas bring into to Edge. And the format would be like 1 hour to 1 hour virtual session with Q&A. Could be a Friday mornings between morning time 10 to 12 or 2 to 4 is dropping. But if you let us know what you want to be trained and what you want to talk to us, so provide 48 hours notification to James or me, then we can help have that training that have a quicker turnaround of the training. So just that one that want to bring it to the group. Jessica. Jessica just had.
No, I think it's just good.
Yeah.
It was just a thumbs up.
Okay. And then back to Natalie. I think that's all I have.
Okay, great. Yeah, so I think that's pretty much the end of our topics. This is talking about the next meeting, and we have a chair. We just don't have a note taker for the next meeting. So I don't know if we could get a volunteer now, if anyone's interested in taking notes on June 3rd. With the transcription, it's much easier, I'm sure. I see a hand. And I can't see who
Aileen
it is,
hands up.
sorry.
Yep, Aileen, thank you. And if
I
any
could do the September one, Rebecca, not the June one.
Oh, okay. Okay. All right. Okay, if email me that if you want to be any roles, and happy to have you. And James and I will always help support anyone chairing or note taking and so on. We can help with the meeting. And also any key topics, then you can email to the chair, and then the note taking also us.
Okay. And are there any other items, or do we want to circle back on anything that we'd sort of put off? I think maybe everything that we talked about is good to continue via email and further communication that way. But if I've forgotten anything, feel free to stick your hand up if there's something you wanted to talk about. I think otherwise, email and then perhaps a small other meeting about the default roles, for example. Okay. Now, Heather,
I
go
do
ahead.
have a quick question. Yeah, I guess it's a quick question slash, I don't know if it would be a comment or not. Like I know that we have these meetings to really look at some of the harmonization in how we each use Edge. But is this also the meeting where, like, if teams have created a workflow or have started to use certain resources, like people can learn from each other, like things that might be more bespoke to the individual sites, but probably, may add value to actually, share that knowledge? Like, I know we're just starting, Natalie, but I don't know if there's other centers that have, actually already jumped over into that piece and can say, hey,
Yeah.
we're using it for the following, and this is how it works, or here's the the workflow, so that people can start to assess, how does that workflow look for our institution? Would that make sense? Would it not make sense? Or how do we learn from each other above and beyond just defining, the common fields and drop downs?
It sounds
Yeah.
like a great idea, especially, I mean, this time we have 20 minutes left. Sometimes,
Yeah.
I think, some of the previous meetings went long, but we hadn't had one in a little while. And so perhaps this is the cadence we're getting into where we will have a few minutes. That's a great idea of how to fill it. James?
Oh yeah. I was going to confirm it was in our initial plan of topics to talk about within the data harmonization group. I think it's in our not SOP, what's it called?
Terms of reference?
Terms of reference. I think it's one of those standing topics. But yeah, we encourage anyone to bring forward anything interesting that they may be working on, or just anything they're excited about. Because anything could help another site do something. You don't know what you don't know. So
I'm just curious about, so any for the best practice and also the AI topic that I mentioned just now, how many organizations have access to Copilot? Are you allowed to use Copilot in an organization?
UHN has Copilot, Rebecca,
Yeah.
but depending on the use case, like we may have Copilot, but we also may have contracts with our, like for our study content with our sponsors that says that we cannot use AI. So it's complicated. Like we can't just load a protocol into our internal instance of Copilot, or it's not clear if that would be allowed based upon the contracts we have in place with pharma.
Yeah, we also, OICR also say that like for what level information. So we're also
Yeah.
not allowing for the protocol and so on,
Yeah.
but the public information that we allow. So if something that is public or So in enterprise mode, I use it. I see Jessica hands up and also Chill. Thank you. Okay.
So I guess like we heard from groups that like the delegation log right now is not being used within the Canadian context. What about some of the other sources? Like how are people using forms and workflows? Have anybody found something that was like a thank goodness for this, or that was really cool or super helpful? Is anybody on the call using workflows yet? I guess do show of hands.
Yes, I can. So Aileen used it. I think JCC used extensively for the workflow. So I can mention a few things that people using, and also Michelle. Yeah, quite workflow is quite used extensively across all organization.
So I guess Eileen, your hands up first. But what is it that you guys use it for?
We use workflows for all of our REB tracking. We use the forms for our cycle visit trackings, and I link that to our finance, our QuickBooks. So yeah, we use forms and workflows pretty much to capture all of our ethics information.
And what were you using before Edge?
Excel.
Okay.
Lots of Excel worksheets, probably more than 200.
There's other. Okay, Michelle,
Also
you
have
use it for
info.
REB and training workflows. So basically like is training, do you use it for like training attestation or just confirming that people did protocol training like at a tracking level, not necessarily sign off level?
Correct. More so from a tracking level, to ensure that the work's been done and to also track how long it took from creating the training document to last signature on the document, because you can set a timeline. So that's quite helpful. One of the barriers around workflow, I will say, is my staff forget to update it. So I grew, my career has been vast in clinical research, and I'm used to using Excels or tracking almost everything I do. Whereas I do find staff who are quite new to clinical research, they don't appreciate those trackers or understand the value in all that tracking. So there is a lot of re-education that's needed. What would be nicer is if the system could prompt it, or maybe as a leader, if I can trigger certain things. I know that you can task it to individuals, but it's not really good in that way, I find, because it gets lost on what's on your list.
I think
Funnily
one thing.
enough, I'm just looking or messaging someone in the team about looking at setting up more email notifications for workflows.
Yeah,
So
workflow
when you've been assigned
notification, need to turn
tasks,
it on,
etc.
right? Yeah.
I know, but as in also sending email notifications to users when they've been assigned to a workflow or when a workflow has been completed.
Yeah, Michelle, the workflow notification can be turned on, but it need to be turned on by individual, if I'm correct, for and what I was talking about, the same thing. So because at the early days, all the notifications automatically by default is turned on. So the user got too many notifications. And later on, the by default, then it all turned off. So now individual need to turn on which one that is the within Edge, turn it on for the pop-up, or the one that by email. So if you feel like you don't receive any notification, or you want the staff to turn on notification, do review those settings.
I think that is a limitation for the email notifications, like with the new change, that it's all managed individually, because like we had a set with every single one of staff at our center when we changed over to version 3 to make sure all their email training notifications were turned on, because that's how we use, for training, central training tracking and reminders. And it's very, very cumbersome. So I don't don't know if there's any sort of way to add an admin right
Yes.
to
Seems
email
maybe
to
I might
notification.
misunderstanding that, yeah, workflow, I look at the list, so I'm sharing this, it seems like workflow is not part of it. So in the dashboard, which one is the internal notification, which one is the email notification? Maybe we can talk to Ben. Ben, is it possible that for certain workflow that can be added
So that's
another?
what I was talking about, Rebecca. We're currently
Okay.
looking at adding in more email notifications around workflows. So
Oh,
it's a
cool.
limited amount at the minute, but we
Okay.
think that people, I think that's what you said, you'd find quite useful if you had more notifications about when you were assigned to a workflow task, or if you're on a team that's been assigned to a workflow task, etc.
Just
And
a
for groups that like are using, like I know there's like the training reminders, etc. Like is this used more by organizations that don't have like an internal learning management system, or is it in addition to your learning management system, or is it just because the learning management system doesn't have like the research content in it? Or is it more protocol training, like very bespoke to the specific study?
Just recently, like within the last year, did our learning management system actually add tracking for like Health Canada Division 5, GCP training, etc. They still don't track transportation of dangerous goods for like, because we know which staff have it or not. They don't track medical licenses. So there's different things we still do. So we've set up all of that tracking in Edge since, the last 5-10 years, whenever we started with Edge, and that works well for us. So I can get a report monthly of, whose NCI registration is expiring, whose medical license is expiring, etc. Because also not everyone's set up as an investigator within our training management either. Like if we have say an ophthalmologist who's just on to do a certain ophthalmologist test, we might have just certain training that she has to do, and we can modify then their requirements. Does that answer your question?
Yeah, that helps. Thank you. Okay. So
Barry, you
Carolyn, you
said
just
that the
said
training expiry notification did not work, and when you tested last, James and I we test quite a few times, so it seems it works for us.
It's okay. Okay. So I need help then on how to trigger it.
Have you
So
set up the reminders in the individual modules, Barb?
It's a reminder need to turn it on. And
Like within the user profile?
So within the actual training module itself.
Actual training module.
Okay, you need to, at the management level.
At
Yes.
this level that you need to turn this reminder on, right? Is it
Yes,
Oh, I
again, the
see.
bell, Rebecca.
this one need to be turned on and adding the reminder
And
what
then you have
they
to
have so for
specify
expiry.
if you want to send it to the user or the
Yeah.
admin. And then
Yeah.
basically, if you wanted to do both, you just have to have multiple entries. Barb?
Okay. So that's not available in our UAT.
It should be. So
But
it's under the training courses, under the management training courses. And then when you click that one, then
you
you can
click
see
into
the the bell,
yes.
then the
Thank
reminder.
you. Thank
So
you very
only
much. Okay.
if that
I
is
see.
turning on, then the email expiry kind of reminder email then can be sent. So both of
Okay.
them need to be turned on.
Got it. Thank you. There we go. That helped
And
me.
I do
Thank you.
like if we have a reminder that goes out, like I could see like city program is there, which is obviously done external to the Edge system. Like, is there opportunity for if a reminder goes out to somebody via email, can they send like if they have to provide documentation of it, or is it just that they would come in and like you would just check off that it was done? Like we still have to actually get the documents and then come in and then check it off. Right? Just thinking like workflow. Jessica?
Just a comment for Barbara. So if you do add this for an individual training course, please note as of version 3, no one will still get the email unless
Oh.
individually in each person's protocol, they manually go into their notification settings and
And
turn
set it.
on training emails, like
Mhm.
check the
Oh.
box. Because
They
the
have to set it?
default is, yes,
Mhm.
the default is no emails. So that's where for
Mhm.
every single one of our people, we had to go in with them and manually update their settings, and it cannot be done by an admin.
Mhm.
So
The admins will still get the email though if you set up the admins, if you've got it turned on.
yes.
So you can also track it for
The
inactive
admins-
users as well.
Mhm.
We have
Yeah,
700
show
Well, the
you the
clients.
admins
screen.
I don't want
Yeah.
the email from
Yeah, 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 yeah.
Yeah, so
Yeah.
they need to, because original by default it is enabled, but then they got too many email and some of them don't have active account, then they block Edge email. So then now they turn it off. The individual, when you set up account, then remind them that which one that need to be turned on and ask them not to block the email. Otherwise, it will block the whole system.
Okay. I think, Heather, we need to talk about if we can get some defaults here for our user import. Yeah,
Yeah.
I know.
I know. I mean, outside the fact that our admins are across the organization and we have admins dedicated to specific programs, right? Like, I think that's part of it too, but it's just a lot of staff to, like, I
oversee.
have no intention of
So
following
usually
up on
when we,
everybody.
so how in the training in the past is that when we do the first training basic, we train everyone that to review this dashboard for which one that you want to be email on. So it's when you set up a user, so at that time, then to
Yeah, but I think it's that
discuss.
we're like UHN is doing their own training, right, Rebecca? Like, not everyone does their training through the 3CTM workflows. Like, it's like
We
other
train the
things.
trainer, so we do the trainer. So we only each organization send the trainer. Then we show them that they need to do that to their groups, and they when they train their own end user, then that the first thing I need to do is remind them that the email notification and which one need to be turned on. So it's not that we train every individual.
Natalie, do you know, like, for our implementation, has our education team gone to the train the trainer or no?
No, we are not. Yeah, only for admin.
Okay.
So the contract that 3CN supported all the Canadian sites here. So James and I, we are the one to do the demo and also train the trainer. But we also, in addition to that one, because when we have the trainer session, sometimes we feel like other people that for the same topic, if they're interested in those topics, they can also join those ones. So it's a free to join someone that already in the session. We announcing that the session. So the one that we have and it's quite open to everyone.
Yeah, Barb's not doing our UHN implementation. I know, like, I think we did it years ago as well, like the train the trainer workflow for the admins, just to see what Edge looked like. I think it's more that when we're having like training modules put together at the UHN level to match how UHN is implementing, are there things maybe that we don't know that have changed that need to get included, right? Because they would be going through like an LMS training.
Yeah, there's so Edge UK like Ben here, so they have a lot of frequent updates. So I do think that we need to have a lot of refresher. Say for example for Edge Finance, there are a lot of involvement now. Is so much better than the before. But in the early days, people say, oh, the Edge Finance is not that good. So then they decided not to use it. But now it's very good. I think a lot of features I like. So we need to have some kind of refresher and then for people to revisit some of the functionality. So maybe some portion they don't have to fully implement it, or if anything they like and so on. So now, so this year we decided to maybe we have more of this drop-in session to get people more familiar with the new features. Yep. Thank you, Michelle. So we also have developed some template for importing into Edge directly. So with the case from something that are very comprehensive. So we'd love to show everyone if for the Edge Finance, we can have the drop-in session for that too.
Okay, so Rebecca, I guess
Yep.
again, just, looking at a large organizational concept. So like when 3CTN is setting up these, like, so right now, if I'm understanding the changes, the information goes from Edge to 3CTN. 3CTN puts together updated training and or drop-in sessions. How do people know when those sessions are, or how to access them when they're not part of 3CTN? Like, how would all of our users at UHN know to attend something or that changes were made? Or like, do you communicate directly with Natalie and then Natalie with education? Like, how would that work? Because I don't know if I've seen the updated finance module. So
So
how would
actually,
people
yes,
know?
I think it's in all, all our kind of thing. So in the past that whoever has the full license, we ask them to provide a key contact to us, who you want us to communicate those one as a key contact. So all the 3CTN member side, we have their key contact. So whenever we have new training, then we email them. So that's one option. The other option in the past, when Ben was started, so we have actually on the homepage, we have a pop-up saying broadcasting to everyone. There is a training, everyone want to sign up, then can broadcast to all someone have have Edge, then they can see that pop up. But UK disabled that one for us because they said, oh, well, 3CN, the announcement here may not be relevant to all other sites that outside 3CN member sites. So maybe you can talk to Ben and see whether we can enable some of the training session that can broadcasting on the homepage so everyone can get notification. So whoever want to join those training, that can free to join.
Okay. Yeah, that might be good. There might also be, and maybe this is already in place, but I think that when there's changes coming, it might be good for centers to be aware of it before the training starts. Just, I think when you're, implementing something net new to like just your own individual team, it's relatively straightforward. But when you're having to figure out how to implement something or coordinate training for thousands of people, it's like moving the Titanic. So like the more awareness there is upstream so that people can prepare and make the relevant decisions, probably the better when you're dealing with really large organizations. So I think like that's part of it. It's like when you find out at the end, it's really hard to figure out how best to support groups to implement things systematically and in a streamlined way so that people don't just kind of go rogue or turn to us for guidance and advice and we have no idea what to tell them.
Yep. I think we do need to think about how can we rhythm. So there's new release and then from the Edge email, the marketing email that for those one, but we can do better. So I have to go to another meeting, so I
Me
will
too.
stop the recording for now.